Good afternoon, everyone. Good
Good
afternoon.
afternoon.
Glad you're here. Those of you in social media world, we're glad to have you on screen watching us. This is April 1, the very first day of April and the very first Wisdom Wednesday for April. And today we are excited to have Ms. Camille Watkins with the Watkins Insurance Firm
Yes.
to talk about demystifying Medicare. But first, I want to tell you what Wisdom Wednesdays is about. It's about sharing and information so that when you are retired or you're about to retire, things that you really want to know. And we've had some really interesting, um, I would say sermons, or they felt like sermons, the topics over since September, and we encourage you to go to the Pyramid Art Books and Custom Framing YouTube channel to see all of them. So, with no further ado, let's have Miss Camille Watkins.
Well, thank you. Thank you very much. As Garbo mentioned, my name is Camille Watkins. I'm an independent insurance broker. I've been in the insurance business now 18 years. When you say it out loud, it sounds like a long time, but it feels like I just started yesterday. So today we're going to talk about getting the most out of your Medicare and what you need to know and kind of ease some of the concerns. I know right now you see the commercials, call now, enroll in this, you can get that. So we're going to clear up any kind of mysteries that there might be for you today. Now, just to start off, does anybody know technically what Medicare is?
It's hard. Well, I know it's insurance.
Yes, it's insurance offered by the federal government. Right. It's for people over the age of 65 or those with disabilities or end-stage renal disease. Now you have to be a legal resident of the United States for at least 5 years too to qualify. So keep that in mind. Yeah. Yeah. Before they didn't have a residency. Yeah. Right. So if you fall into that category, you live in the United States, you're either disabled or over the age of 65. And technically, you have to be disabled for 25 months or 2 years. And then on that 25th month, you qualify for Medicare. And let's just talk about when you can enroll in Medicare. You can first enroll in Medicare, of course, when you're turning 65. You have 3 months before, you have the month of, and 3 months after. Now, say for instance, you're 65 and you're working and you have health insurance. You do not have to necessarily leave the health insurance to enroll in Medicare. So that's why it's always a good idea to sit down and talk with a broker or an agent. And something to keep in mind too is you're entitled to these benefits. A lot of people have trouble with, oh, it's government this or that. It's something that you've earned. If you worked and you looked at your pay stub, on there it either has FICA or Medicare taxes. So if you've worked or you're married to someone that worked at least 10 years, your Part A, your Medicare is already covered. And let's talk about the parts of Medicare. You have Part A, which is inpatient care, hospital stays, skilled nursing. Some forms of home health also qualify as Part A. And then you have Part B. You have Part B, which is all the outpatient care, so doctors, visits, outpatient surgeries. And if you notice now, most of your care is going to be outpatient. After a while, they'll have us going through a drive-through to get our outpatient care. So keep that in mind. And then we're going to talk further about Part C, which is Medicare Health Advantage, and Part D, which is prescription drug coverage. And if you guys have a question or anything, just let me know. But Medicare Health Advantage, again, is Part C of Medicare. What it allows you to do is take those hospitalization or Part A benefits along with your Part B benefits and you're combining everything into one plan, and you're letting a private company manage those benefits for you. One thing to keep in mind, you can get prescription drug coverage too. Part A and Part B, or original Medicare, do not include prescription drug coverage. So keep that in mind. And original Medicare does not include things like dental and general and vision. You can always add those to your coverage. Now, there are a few types of Medicare Health Advantage plans. You have HMOs, or health maintenance organizations, and that means you have a network. Network just means doctors and hospitals and other providers that are already contracted to treat you as a Medicare beneficiary or a part of a plan. You have PPOs, or preferred provider organizations. How many of you have heard of a PPO before? If you're familiar with the PPO, the difference between a PPO and an HMO is if you go outside the network with an HMO, you're responsible for all of your costs. If you go outside the network with a PPO, the plan still pays, you're just responsible for a higher percentage of the cost versus being in network. So that's something to keep in mind. And there's also a third type of plan, which is private fee-for-service. Private fee-for-service you don't see as much as you used to. Medicare, original Medicare, is a fee-for-service program where the provider, you don't necessarily have a network, but the provider agrees to bill your plan. Okay?
Can I ask a question?
Sure.
My question is, and I have to repeat the question.
Mm-hmm.
If I have a unique health issue and I'm covered by Medicare, and I also have another insurance company, and I want to go to like the Mayo Clinic,
Mm-hmm.
okay, does my Medicare kick in for that? It's outside the
The question is if you have Medicare and another plan, will Medicare pay if you go to a provider like MD Anderson in Texas, for a good example? Yes. Now, it depends on whether or not that other plan will pay, as far as if it is a network plan. But Medicare is your primary. Most times, there are actually three different types of coverages that pay along with Medicare. You can have Medicare, and some retirement plans also offer Medicare supplements, which are completely different than Medicare Health Advantage plans. Because like you're talking, with a Medicare supplement, in general, Medicare pays first, Medicare pays 80%, and then your supplement picks up some, if not all, of the 20%. Because your costs in Medicare are static, but yes, it would, depending on the plan, the private plan. But Medicare, as long as that provider is able to bill Medicare, it doesn't necessarily matter where you live. You know, you may have to travel for treatment. Your Medicare will travel with you inside the United States. Mm-hmm. And then a few other types of plans that you can have along with your Medicare. Of course, you can have private insurance or the Medicare supplement. Sometimes they come to you through your retirement benefits, or you purchase a private supplement, or you have VA benefits. If you have VA benefits, it depends on whether you have VA CHAMPS or how much is covered after Medicare. So keep that in mind. And then, of course, just to reiterate, this year, your responsibility with Medicare has changed. This year, the standard Part B premium, that's the amount that if you're collecting Social Security, it's being drawn out of your Social Security every month before you get the payment. This year, that payment is $202.90. And then your Part B deductible this year is $283. And a deductible, think about it like a kickstart. It's what you have to do, is what you have to pay to get the plan to pay. Because in general, with Part B, you have a Part B deductible of $283. It's an annual deductible. So once that's met, that's all you're responsible for as far as deductible. That's the annual Part B deductible. So that's, just say you have original Medicare Part A and Part B. Your first doctor's visit or first outpatient medical service, you would be responsible for the first $283. And then after that, Medicare would pay 80% and you would pay 20%. So keep that in mind. There are some costs. And depending on what plan you choose, you may also not be responsible for that. Now, let's talk just a minute about Part D, which is your. Okay. Let's talk about Part D, which is prescription drug coverage. This is exactly what it sounds like. It helps you cover your prescriptions every month. Most plans have 5 tiers. The tiers are arranged by cost. Tier 1 is the least expensive. Tier 5 is the most expensive. Some plans even have a Tier 6 for specialty benefits. This year, your Part D deductible is going to be $615. Now, you can choose a plan that will cover some, if not all of that.
This is medicine.
Yes, this is for medicine, yes. And then your maximum out of pocket this year is $2,100. That means after you meet your deductible, your co-pays and your co-insurance, if they total that amount for 26, you don't pay anything else out of your pocket this year. So you do have a stop loss built in, because as you know, especially with prescriptions, you can pay and pay and pay and pay, and there's no stopping. So know that there are some spending gaps in there for you.
Does it depend on the type of medication that you're taking?
Yes.
I went to the pharmacy the other day and I asked them, I said, what is my out of the pocket for my blood pressure medicine? And they told me nothing. I didn't have to pay anything.
Right. The question was, does the cost depend on what the prescription is? And the answer is yes. The tiers, tier 1, 2, 3, 4, and 5. Tier 1, your medication may fall, depending on your plan, may fall into that category, because in general, that's preferred generics or the least expensive medications. So the plan that you're in is picking up 100% of those costs. Whereas tier 2 is a little more expensive, that's just generics. Then tier 3 is preferred brand. And how you can kind of gauge whether or not you're taking a inexpensive medication, I tell people all the time, if your prescription has a commercial, you're probably going to have a copay, because those are brand name drugs. And then you also have a tier 4, which is non-preferred brand name. They generally cost even more. Your responsibility is higher. And then same with tier 5. And a lot of times, again, there may be a category in your plan, tier 6, that eliminates some of the costs for you, just depending on the plan. So, any questions about that?
Generic drugs versus the real, there is a difference. Right?
Yeah.
I mean, it's not supposed to be. Is there?
What I've been told, as far as just the difference in generic and brand name drugs are still under patent. Are still under patent. So whoever developed the drug, they control who sells the drug and how much that cost is. Like, for example, Plavix. Plavix was a really popular, or still is, really popular, really common heart medication. Now there's a generic for Plavix, but for 7 years, You only were available for Plavix, and Plavix was pretty expensive. Now that they have a generic for Plavix, not only can that original manufacturer make it, their competitors can make it too. And what the difference is, I've been told, in generics and name brand drugs too, is sometimes the ingredients may vary.
Sometimes they won't.
The ingredients may vary, but the main ingredient, for instance, some drugs have already built in something that won't upset your stomach added into it, where the generic might not have that. That's how it's been explained to me. But in general, your generic drugs are older medications and they have more than one maker. Yeah. Yeah.
It's still safe.
Mm-hmm. Yeah, it's still very safe. I mean, most of the time you're going to talk with your doctor about whether you're going to take the generic or whether you're going to take the name brand drug, just depending on your personal condition, you know. So that's something to always keep in mind. Yeah.
And that changes every year.
It changes every year. Yes, because all Part D plans have a formulary or a list of drugs that are covered by the plan. And most plans have a very wide formulary. But every plan is not required to cover every drug. So you have to keep in mind, is the plan going to cover the specific medications that I take? And the formularies do vary from plan to plan. So that's something that you have to take a look at each year too. Yeah.
I know when I was getting my, trying to figure out which plan is beneficial for me, I had to call into them, or they called me, and they wanted a list of all of my medications.
Yes.
Everything that I was on, from my inhaler that I take, from my asthma, to my blood pressure medicine, to a cholesterol pill that I take. I had to give them the whole list.
Yes.
And they had to make sure that that was, covered.
Right. And that's something that you need to do every year. Yeah, to make sure that the plans only run from January 1st to December 31st, so they can change. And you do want to make sure that you know that all the medications you take, how much they're going to cost, how they're going to be covered, and if they're going to be covered. Because there's no guarantee from year to year that a specific medication has to be covered by a plan.
Mm-hmm.
So that's something to always keep in mind. And then two, that's Part A, Part B, C, and D. Let's talk just for a second about Medicare supplements. You might hear some people calling them Medigap plans. Medigap plans are completely different than Medicare Health Advantage plans. Medicare Health Advantage plans are Part C plans. They are Medicare plans offered through health insurance companies. They're a health plan. A Medicare supplement is exactly what it sounds like. It's a supplement to Medicare. It pays along with Medicare. And you have several different options with Medicare supplements. With Medicare supplements, you can choose if you want your Medicare deductible paid, if you want all or part of the 20% paid. But again, with the Medicare supplement, it's private insurance. So you do not have a network. You just have to go to Medicare providers, because with your Medicare supplement, Medicare is billed and the supplement is billed.
So this is all
It's optional. Yes, because you're going to have the choice between one or the other. You can take your Medicare benefits in a Part C plan or a Medicare Advantage plan where you're combining everything. You're putting A, hospitalization, B, medical or outpatient care, and D into one plan. Or you can choose to have Medicare and a supplement. One thing to keep in mind about supplements, they do not include prescription drug coverage, so you will need to still choose a prescription drug plan. For example, they're offered in plans A through N. Medicare is in parts, supplements are in plans. Plan G is a supplement where after you pay that Part B deductible, then your supplement picks up the 20% for you. So all that you're paying is your premium for the plan and your Part B deductible. And again, the reason why somebody would do that, in general, if you don't want to have a network plan, that's a good way to go. And again, you must add, if you need prescription drug coverage, you will have to add it as a separate Part B plan. Go ahead.
And another example could be if the doctor, you have a specific doctor
Mm-hmm.
that you want to go to, and they are not in the advantage.
Right, right,
Yeah.
right. That's one of the best examples. The question or the comment was, if you have a doctor that's not in network with Advantage plans, Medicare supplements are a good way to go. As long as that doctor is willing to bill Medicare, they have to bill your Medicare supplement.
This is the one, this policy is the one that's often on television.
Yes.
It seems to be the most confusing part.
Mm-hmm, mm-hmm. Part C is the one that you do see advertised the most. One thing to keep in mind with Part C, again, you have one payer. So instead of Medicare paying to the doctor and then a supplement paying to the doctor, with Part C or Medicare Health Advantage, the Medicare Health Advantage pays the doctor.
See, what I see on television primarily is like they offer certain benefits.
Yes.
Like you get to go to like a gym membership.
Right.
They give like food allowance.
Yes. The Medicare Health,
Qualify for that?
you do. Depending on the plan, you do have to qualify. One of the plans that some Medicare health plans are what's called special needs plan. One of the special needs is that you're also Medicaid eligible. So you have to not only be a Medicare beneficiary, you have to have Medicaid as well. The difference in Medicare and Medicaid is Medicare is for someone over 65 or someone with a disability. Medicaid is strictly based on your income. And in general, as a single person here in Arkansas, if your take-home pay is less than $1,700 a month, you may qualify for Medicaid benefits. So keep that in mind as well. And go ahead.
Chronic health issue.
Right. Some of the plans, the special needs can be Medicaid, it can be a chronic issue. Heart and diabetes is the one that you see most common. And what those plans do, they offer special benefits for those needs. You know, you may have a reduced cost when you see your cardiologist. You may have a food benefit. Most Medicare Health Advantage plans, those are things that they're offering you something that you don't get just with the original Medicare. The gym membership, 24-hour nurses hotline. A lot of plans also, depending on your individual situation, if you're released from an inpatient hospital stay, you qualify for meals delivered to you. You know, because when you're recovering from a hospital stay, a lot of times people neglect the nutrition part of that stay. So those are some of the things that come along with a Medicare Advantage plan.
The confusing part to me regarding Part C. Okay, there is a cost for Part C,
Mm-hmm.
additional cost.
Yes.
Some insurance plans, like which is one that you have now, United Healthcare, see,
Mm-hmm.
Health Advantage.
Mm-hmm.
I don't get the same benefit that she gets.
Mm-hmm.
Like with, I get the, I used to get the $88
Mm-hmm.
groceries. This year they cut it down to $75.
Mm-hmm. Yeah. Yeah.
You use it every month and you get it. And they reload my card. It's like my insurance card. I mean, I can also get over-the-counter meds.
Mm-hmm.
Is that specifically for Medicare?
It's from my United Healthcare plan. I used to be Health Advantage. That's what we had when we were employees.
Yeah. The Blue Health Advantage. Yeah. 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 It's not just specific to United. Some of the other carriers do too. Yeah. Yeah. Yeah, that's again one of the things the benefits of having an advantage plan. Yeah, because it's not renew. It is renew active for United, but it's the same concept as Silver Sneakers. Any Silver Sneaker, any gym facility in their network, you can go as much as you want to. Yeah. Yeah. No, they do not. I don't know why they don't. Jim Daly, Patrick Henry Hayes, the community centers, they've been working on it for a long time. Okay.
The senior center.
Okay.
And, matter of fact, I think it's already been approved.
Really good. Okay, that's good. I'm gonna have to look into that. But some of the facilities are just you go in, you work out, that's it. Some of them have classes that are specific for Medicare eligibles, like chair yoga, water aerobics. I know the North Little Rock Athletic Club. I like that facility a lot, and they have a pool. And again, any part of a basic membership of that facility, that's what you're entitled to with Silver Sneakers. So if you wanted to go every day, you can do that, and there's no additional cost.
How do you find out, going back to the stipend for groceries?
Mhm.
How do you find out?
Mm-hmm.
So how do I find out if that exists with Humana? Because I didn't know that.
You can look at your, the question is, how do you find out if your plan has that over the counter allowance? You can look at your summary of benefits. You can always call your agent. They should know and be able to tell you. And you can go online and look at your agent portal too. It has all of your plan information there available to you. It even shows you where you're at as far as how you use your coverage for the year. Do you have the Gold Plus plan? Mm-hmm. Mm-hmm.
But I've never seen anything as a groceries.
Mm-hmm. And it's specific to the plan. Like Humana, Aetna, WellCare, some of the other carriers, they offer plans that also have that grocery benefit in it, but it's specific to the plan. For example, there's a special needs plan with Humana for those that are what's called dual eligible. That means that you're enrolled in Medicare Part A and B, and you qualify for Medicaid. And in their case, they get like $220 every month. And you can use, depending on the plan, it's not just for groceries. You can also use that plan for utilities, for pet care, and things like that. Pet care. Mm-hmm. Go ahead.
Back in my car, it's just like a credit line. It has and when you go to Kroger or whatever, it'll scan it. Now there's certain things you cannot purchase with it. It won't pay for it. But health is stuff.
Right.
Well, mine, it works the same way, but only for like Walmart, Target, any of the drugstores, and it's for drugs. I mean, it's for drugstore stuff.
Yeah.
Right.
It's not for food.
I use that a lot of shit Kroger.
Yeah.
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 And I know when I get my fast card, I put my items on there to be scanned to pay for them. I know that there's things in that the card is not gonna pay for, but it will pick up those things that were housed. And then if you listen as to the ones that has an extra money, because you see, you pay all benefits.
Yeah.
I mean,
I heard that before. They told me.
if you don't lose it within that month, you lose it because it's gonna be loaded for the next.
Mhm.
Like today is the first, my card is loaded already for $75, and I can use it at Kroger or anywhere.
Yeah. Well, yeah, that's one of the best benefits, in my opinion, of some of the Medicare Health Advantage plans is that you can use it for things other than going to the doctor. I mean, most of the time, your fitness and your nutrition is what keeps you out of the doctor's office. So, depending on the plan, those benefits are there. And they do vary because some of the plans also have that benefit that rolls over. So, you can save everything up to the end of the year and then use it. So that's something to keep in mind too. Go ahead. Sure.
The United Healthcare offers a monthly credit for healthy foods, groceries, and over-the-counter products for eligible members.
Mm-hmm.
How do you become eligible? Because it said this benefit is primarily available through dual special needs.
That's what I was talking about earlier with the dual special needs because United Health has several different plans. Not all of them though have to have Medicaid to get it. Yeah, you don't have to have Medicaid to get that rollover on all of the plans. There are different plans, different levels of Medicaid too, determines the amount that you get. And again, you don't necessarily have to have Medicaid, but when they say dual eligible at the ad that you're looking at, that's what they're talking about. In that particular case, you have to have Medicare and Medicaid.
That's what they said.
Mm-hmm.
But they said
You don't have to have it for every plan, but what she's looking at, because yeah, you don't have Medicaid, because you'd be getting a lot more if you had Medicaid. But the one good thing about that U card too is that's one card for everything. So you use it at the pharmacy, doctor's office, everywhere you go, you have one card. Some of the other carriers, you have a couple different cards, but they all do basically the same thing.
We're retired engineers.
Mm-hmm.
So when they were promoting United Healthcare, it just seemed like it was too good to be true.
Mm-hmm.
So I'm one of those conservative guys, thinking people. So I'm saying it's already working.
Right. Right.
It was working for me, but the only reason I switched, and I was, and it's because I was told by my primary care that I was pre-diabetic,
Mm-hmm.
and I did have an underlying health condition, and I think that was the key for me getting it.
Mm-hmm.
When my husband was alive, he was kidney end-stage kidney renal disease.
My
He always
goodness.
had it.
Right. Mm-hmm.
So he got everything that was out there because of his end-stage kidney disease.
So the best thing is to talk to your insurance provider.
Yes. Yes.
Really like the haircut.
Right, because you're going to want to check your specific, again, it's very important to check your specific prescriptions to know how they'll be covered, how much your out-of-pocket costs are going to be, whether your doctors that you want to see and the facilities that you want to use are available in the plan. Those are the two biggest things. And then, of course, we're talking about Medicare Health Advantage. What are those extra benefits? Because there may be a plan that you get just for example, $75 a quarter for your groceries over-the-counter allowance, but maybe, just for example, it doesn't have silver sneakers. And you do go to silver sneakers and you do enjoy working out. Because the plans, again, they vary. Or maybe there is a plan, a Medicare Health Advantage plan, they also include vision and dental. How the dental is covered and what the dental allowance is are different from plan to plan. So you may have a plan with a really good dental allowance. Maybe it's paying $4,000 a year for your dental, but there's no grocery benefit. So those are things that you have to keep in mind. That's why it's always good just to sit down with your broker every fall at least, because October 1st through October 15th, that's your pre-enrollment period. That's when the coming year's plan information is available. Then October 15th until December 7th, that's your time for your annual enrollment. This is when you can change your coverage. If you don't want to change your coverage, you don't have to. If you're satisfied with the changes for next year, just let everything roll over. And then you also have an open enrollment period from January until March 31st. If you enrolled in a Medicare Health Advantage plan, you have one opportunity to change it. Those are examples of just the general annual enrollments. You may have a specific enrollment period. Maybe you've moved, you know. Maybe you've become Medicaid eligible. All those things require or grant you a new enrollment period. So that's something to keep in mind. And how you sign up for Medicare. It used to be by the time everybody was 65, they were ready for retirement. They were going to collect their Social Security, and that was all there is. That's not the case anymore. So if you're going to continue to work into your 60s, 65, you may not draw Social Security. You may choose, I'll draw it later when I actually retire. In that case, you need to get in contact with Social Security and apply for your Part B. And it's really easy to do. Otherwise, if you are going to collect your Social Security, it just automatically starts. It starts the month of your birth. If you're born on the 1st of the month, it starts the previous month. So all the April 1st babies today, their insurance started March 1st.
Then you get a certain age, Social Security, and I've been penalized. You can make as much money as you want. So I did it. I retired twice.
Okay.
This is so rich. But I retired twice. Second time I went back, I was drawing Social Security and retired. And my reputation.
Yeah.
You get a certain age.
Yeah. You can. I think it's to 70. I don't know. I'm not going to say, I think it's 66 and a half, but I'm not sure. I'd have to look at that.
It is time.
Yeah. Oh, yeah. You may have to reimburse Social Security. Well, not on your case, but there are people that end up working too much or earning too much. Yeah. And they end up.
You know, I decided time 13, I just came on out. 2 was enough for me.
The 2 is more than most. And again, we talked about Medicaid, but also know there's a Medicare savings program through Social Security. And what this does, it helps you pay for that Part B premium. Again, if you're low income, Social Security or Medicaid may help you with that payment every month. If you qualify, they take up most, if not all of it. And they can help with the prescription drug costs. What other questions do y'all have?
What can you tell me about that? You said you mentioned some VA champs.
VA Champs is for veterans and veterans' families. It's a health program through the VA system, and it can coordinate benefits with Medicare, but it depends on the individual. Okay. Let's see. And again, just keep in mind that when you're looking at your Medicare benefits, you're falling back on the standard of Medicare. So what you're really choosing, I know there are hundreds of plans to choose from, but know that all plans have to be as good as what you would get with original Medicare. They have to be considered credible coverage or as good as what you would get with original Medicare. So yeah.
So how is that plan different from my plan?
All the plans can. Your plan, I looked at your plan. Your plan is available through your retirement plan. So that's why your plan is different. there are different Medicare Health Advantage plans that are available here in this county, but the plan's different. They all have different copay amounts, different allowances for your groceries, utilities. So the plans vary. That's why the plans are different. Medicare Health Advantage plans, again, they have to all cover what Part A and Part B covers, but they don't have to be the same, and they're not the same. Copays are different, the benefits are different, the network is different. So that's why you could say you have an advantage plan and you have an advantage plan, and they're totally different, totally different.
Circumstances.
Yeah, yeah.
You don't get the, you don't get the grocery allowance. I do. It could be my fault.
You might want to call the plan, but your situation is a little bit different because you're on your retirement plan from an employer. So that's different than just the plan that's on the regular market. All right?
But I mean, I was at advantage up until I had to change. But when I had healthcare, there was a plan for educators. I really do.
Yeah, that's a,
And it was stable. And I know that, but I had. Oh my God, and
yeah, because there are different benefit packages from plan to plan. There's different benefit packages from plan to plan. Difference in the cost, difference in what your cost share is, all those things. Yeah.
like you said, dental, food subsidy.
Right. Versus your copays, you know?
And say I got a code on the back. They scan it just like a credit card
Yeah.
when I pay for my groceries. And is it annual or not? It's monthly. They reload it monthly.
Yeah. Yeah. They don't. And that's yeah. Because you may have it too in your package. Yeah. Because it does change. It wasn't always there. Yeah. Yeah, I would double check. Yes. Yeah, I would double check with them, but I don't think y'all have a food allowance. Because I've looked at that plan before. It may not be the same plan.
I think she got what she got. Oh, that's right. She should be. She's going to be out in there. Sharon is this one.
Okay. Y'all are retired teachers? Okay.
Retired, but they can't have anything.
Okay. Good.
Yeah. Dr. Lou back there is too. She said nothing, but she is. Yeah.
Well, that's everything. I thank y'all for the time. You know, reach out. I don't know if he wrapped it or Garbo's gonna come and say anything. But catch us, you know, the April 15th, The Power of Artificial Intelligence. Al Keaton will be here. I'm definitely gonna come to that one because AI is everywhere now.
AI is everywhere. So that is our next one.
Which will see
April 15th, Wednesday, April 15th.
Oh yeah.
We will have the power of artificial intelligence. So we think that there's such a, because, well, I don't know. We don't need computers. We don't need visualize anything we do. You're touching
Yeah.
artificial intelligence. I'm sure that what Austin is doing has some artificial intelligence that we just don't know. But I got some things that I know. Artificial intelligence. We've got Easter egg hunt coming with our very own Maria Hoskins. And she will be reading her book. This is the 9th time that we've done this event. We're doing it with the garden, the Dunbar Garden. So it'll be on Saturday at 1 o'clock. And if it rains, it'll be here. Now we're gonna have the Easter egg hunt in the gallery. I'm not sure, but we will still have it raining. If it's raining, we'll be inside. So keep that in mind and support Maria. The next item I want to share with you is about our Veil Book Club, which is actually started. And we're having another roundup on April 19th, where you get on, and basically it's kind of like, you remember when you were little and you got those highlight books in the mail? So we're bringing that back. So every month, your child will receive a book. And then we've added a technical piece because we have a young lady, Lana Berwood, who lives in Philadelphia, Pennsylvania, who will do a review of that book. You'll also meet a new author, and there'll be all types of things that children who love to read, that will meet other people. When we had our first round last month, we had 7 states on the call.
Wow.
We had children from all over. And so basically we'll start in June, but our next call is April 19th to get an understanding of what it's about. So keep that in mind. And because you are here, we want you to know, because the whole point of the book club is to help young people build libraries. Because every book, you don't need it, but you have a library card. We encourage all families to utilize their public libraries. So we want you to have your own personal library. So, do we have a number? Yes. Pick that number for me. Pick the number. Don't look. That's Alicia Hobbs. Oh. Young person, start their library links whenever, or you can find that book. Yeah, that's okay. So we're busy with Maria Hoskins. On April 18th, we're doing the 2nd Arkansas Authors Book Festival. Our very long Maria Hoskins is going to be one of the co-hosts that will be walking around talking to us. You want to come over here and talk a little bit about the book festival and what's it's very hard. It's April 18th, okay, 10 to 2, and it's at the UCA Brewer.
Yeah, the Arkansas Authors Children Book Festival will be held April 18th, beginning at 10 a.m. And I have the honor of co-hosting with the infamous Craig O'Neill. And it's held every year, and it celebrates the works of Arkansas children authors. And it's pretty much an all-day affair. And I would encourage everyone to come and bring your children, grandchildren, everybody's welcome. It is a fantastic program. Yes.
Well, thank you so much. And what do you do the year? Do you do the children? What I is
I am going to go around and I'm going to visit with various authors. And we're going to talk about their books, to introduce the books to the audience. Yeah.
20 to be exact.
That's a lot of artists.
Wow.
Where's the located again?
This will be at UCA.
Florida Community Center, which is right next to PBS, Arkansas PBS. So on the first dinner, you'll see the big sign, and then we'll have a big Luna.
Yes.
Will be there.
Which is several
You
years.
see this big, amazing.
Yeah, it's lots of entertainment as well, because you can have a magician, Mr. Bubbles,
All about making you more
food trucks. Food trucks are there, so we can eat. And
Eat and read, or eat and read. Next announcement is about Florence Price. How many of you know who Florence Price? Florence Price is the first Black American composer to have her music played by a symphony.
Wow.
And she lived three streets over on Cross Street.
Really?
She
Wow.
played at Philander. She taught at Fuller. She played at Allenstown Presbyterian Church. Her last concert in Little Rock was at Dunbar Middle School.
Wow. That's
If you
cool.
look her up, she's recently won Grammys for her music. So and for the last 10 years, we have been celebrating her birthday. So for this year, the Dunbar Historic Neighborhood Association is having a garden party in her honor, April 11th from 2 to 5. And the mimosas and wine, and they want you to wear your finest derby hat and embrace the spirit of elegance. That'll be on Saturday, April 11th. On Friday, April 10th, we will have a Florence Price birthday party. And so we will have 2 concert pianists playing her music. We will also have 2 young women who have amazing voices that will be singing her music as well. And we'll have cake and punch and maybe a little wine. Who knows? We're going to have a happy hour in honor of Florence Price next Friday, April 10th at 5:30 here, right here. So we're excited to celebrate Florence Price once again. So we have another, Easter's coming up. Who's gonna get this gift?
That would be Don Hall.
Who that's not? Jackie.
It does.
So see what it is. What did you get?
oh, it's my artwork.
Any piece of art in the gallery.
That's a good, Brian.
So one more.
Thank you. That helps.
That would be who Wax.
It is like that.
Thank you all.
Thank you.
Thank you.
Thank you, Camille, for sharing.
Thank you.
Thank you so much for coming every Wednesday and doing the segment for us, but definitely today was inspiring and we got a lot of questions answered.
Well, thank
How
you.
did you Did you give them that phone number, that email?
Yes, to reach me directly, call 501-258-8198. We're available 7 to 7, Monday through Friday, Saturday, 10 to 5. You can also email me at CamilleWatkins.WatkinsInsurance.net.
Okay.
Uh-huh.
And you have demystified Medicare. So thank you so much.
She will make an appointment with you here.
Yes.
And she's also her
Yes.
second gallery and her second office.
Yeah.
That we make. So no reason not to deal with, not understand Medicare. We make it easy for you.
Yes.
We will see you when will we see you next? Tell us in the audience.
April 15th.
What are we talking about?
Artificial intelligence.
We'll see you then. And those of you in Streamland, if you can't get out here, pull it up again, April 15th at 1 o'clock. We'll see you soon.
See you
Thank
soon.
you.
Thank you. All right. Don't leave your glasses. Are these yours? Yeah.
No.